I mean, the promise of the EHR is really makes sense. This is why it sort of came forward, right? It was supposed to make medicine safer, bring higher quality care, empower patients, and even to a certain extent save money. It was going to bring data together, empower researchers to find new cures, allow people to be more portable with their health record, show up at a place with their health record, so that you would have the information you needed at the point of care. And where life and death decisions are being made, you would have a complete record. And these are, that's the promise of the EHR, and these are good things. That's where we started. All right, so that's enough sort of setting it up. The goals are the goals are good, right? I mean, this is what we were promised, and the goals are still, we still believe those goals to be, I think we still believe those goals to be attainable somewhat. Wouldn't you say?
Absolutely. I would say that we actually are achieving many of those outcomes in pockets and in certain organizations with certain strategies and sets of systems. So I personally have seen positive outcomes with, being able to change, let's say, practice patterns related to ordering IV Tylenol is one example. IV Tylenol is extremely expensive and most often not necessary. And so by some of the leverage in how you configure the EHR at NYU, we were actually able to change practice patterns, eliminate excessive ordering of IV Tylenol, and save a significant amount of dollars. I think likewise, looking at things like over ordering of certain lab tests is another example, or over administration of blood when it doesn't really meet the criteria that the organization has set forth. So I think that absolutely it has enabled us to achieve some of these outcomes. But in some cases, it takes an army of people to make those outcomes happen. You have to have an organization that has, a talented pool of people to actually, execute a strategy around both from the clinical side to make sure that you're getting the right buy-in and addressing where there are challenges, and also from the IT side so that people understand what is a very complex system. So I think it's possible, but it is very challenging.
Yeah, it's interesting. It's almost like the capstone project or the thesis that you're going to have to do for your doctorate of a leadership team at a health system. I mean, to put an EHR in, you're taking, first of all, a health system isn't one business; it's 100 businesses, and that are all interconnected and all have very complex nature to them. And then you have all these workflows and all these things that you're doing. And it is sort of the capstone project where you have to figure out, okay, how do we bring all the right people together? How do we ensure quality is maintained? Every health system you go into and you say, what's your number one thing? They will say quality. People place their trust in us and we want to be trusted. So no one's starting out with the thing of, hey, we don't care about quality, just get the EHR in. But it is a test. So, one of the things they start talking about is pretty early on is that these systems are unintuitive, I guess is the nice word they would say. And the words get to be like unintuitive, and then it gets clumsy, hard to navigate. That's where the title comes from, Death by 1,000 Clicks.